We're going to get started in a few minutes. So we're just waiting for a few more people to join us and we'll get started. All right, Carrie, you want to get started?
Sure, Kathy. Well, good afternoon, everyone, and thank you for joining us today. My name is Carrie Shannard-Kunders. I'm the Executive Director of the South Dakota Board of Pharmacy, and I chair NASCA's Education Committee. I'll be hosting this afternoon's webinar along with NASCA's Kathy Keogh. Hopefully you read some scrolling information while waiting for the webinar to start, which included information regarding our sponsors, the NASCA disclaimer, housekeeping, and other issues and announcements. Today's webinar and all of our webinars throughout the year would not be possible without the generous support of our sponsors. So thank you to our sponsors. Also, the NASCA Travel Scholarship for this fall's meeting, the deadline has been moved to June 16th, and the award amount has increased to $2,000. This is a fantastic way to attend one of the best conferences in the U.S. See our website at nasca.org for information on that. And additionally, as a reminder, the DEA relies on PMPs to assist in establishing their production quotas for certain drugs as required by Congress. This is a deadline, this has a deadline of June 1, 2023 to provide your information to them. For Bamboo States, this is easy as the report has been made available for you in Tableau. See the NASCA website at nasca.org for more information, and then submit the data by June 1 to Stacy Harper-Avila at DEA.gov and Claire Brennan at DEA.gov. So, having said that, thank you very much for taking time out of your busy schedules to join us for today's webinar, National Drug Early Warning System, NDEWS, Year in Review, Epidemiologic Methods to Detect New and Emerging Substances of Concern. The NDEWS system is funded by the National Institute of Drug Abuse, or NIDA, and aims to provide the field with the most timely, salient, and valuable information on emerging drug trends through real-time surveillance to detect early signals of potential drug epidemics. Among all the acronyms we have for all of the organizations we know about and are partners with, NDEWS was not one that I had been familiar with. So I imagine there are some of you as well that are also not familiar. So it's exciting to have them here today with us. I'll only provide short introductions because we have many speakers with much experience and many credentials. So we have Dr. Linda Cottler, PhD, MPH, FACE, Principal Investigator, Dean's Professor of Epidemiology at the University of Florida. Dr. Joseph Palamar, PhD, MPH, Deputy Director, Associate Professor, Department of Public Health, Population Health, New York University Langone Medical Center. Nay Wan and Anna Wang, NIDA T32 Predoctoral Fellows, Department of Epidemiology, University of Florida. Daniel Van Zant, PhD student, Stiles-Nicholson Brain Institute, Florida Atlantic University. Dr. MeLisa Kramer, PhD, MPH, Project Scientist, Deputy Branch Chief, Epidemiology Research Branch Services and Prevention Research, National Institute of Drug Abuse. Doctors and pre-doctors, please enlighten us on NDEWS, and thank you for being here.
Thank you so much, Carrie. Thank you very much, Kathy. It's a delight for us to be here today. We're going to be telling you about some of the things that we're doing and the things that have been the initiatives we've had in the past 12 months. So I'm going to start with an introduction and overview, and I do want to thank our partners from the University of Florida, New York University, Florida Atlantic, and of course our funder, the National Institute on Drug Abuse. We're in this together. This is a cooperative agreement. We meet every single week, and everything we do really involves all partnerships. So, as we all know, that the current landscape is such that we're looking at information on drugs used and the harm caused by them with lagged data. That is, some of the data we don't see for at least 6 months on an average 1 year. So we really need to have the freshest data on emerging trends of compounds, the routes of administration. What are the hot spots? What about the demographics of people who use and people who have consequences? And we really feel the need for an increased collaborative effort between organizations and agencies. And that's why we're so happy to be here today talking with you. So this is the model that we came up with when we first proposed NDEWS, the National Drug Early Warning System. And it was the early warning network on the left. We have 17 Sentinel sites. We have a virtual network. We have collaborations and collaborators across the country, and even now Canada and Mexico. We have local, state, national information that feeds into our coordinating center with the Scientific Advisory Group and the National Institute on Drug Abuse. We're always trying to harmonize our data, looking at trends, and also looking at hotspots. We use different approaches, one of which is a novel surveillance approach with some rapid street reporting, some virtual health street reporting, machine learning, hotspot reporting, wastewater epidemiology, and real-time 911 dispatch data. And we also have the more traditional surveillance with some of these other initiatives like the high intensity drug trafficking area drug seizures from Office of National Drug Control Policy data, medical examiner, poison control, etc. So these are the areas that we're doing surveillance with. So the aims, as you heard earlier, are really to monitor and find out what's going on in the field today, looking at hotspots with high rates of drug use or morbidity, mortality, and using some of the darknet real-time 911 dispatch data, doing some rapid street reporting, which is very novel, and looking at the virtual way of looking at people with lived experience. So we call ourselves the coordinating center at the University of Florida. Today, you're going to hear from some of our emerging scientists. One of the things that we've been doing with NDEWS is really giving our younger scholars, those who are on our training grant, the opportunity to lead, manage, and analyze what's going on in the field. So we have Nicole Fitzgerald, who's been involved. We have Andrew McCabe, Anna Wang, Nay Wan, and Daniel Van Zant. We also are advised by a number of scholars in the field. This is our scientific advisory group. And you can see their names are here with Joseph Palamar being the lead, the chair of the SAG. We have people from University of Maryland. We have people from the Research Triangle Institute, people from the Office of National Drug Control Policy. We have people from high intensity drug trafficking areas. We have people from California, San Francisco, SAMHSA, Washington University, Nova Southwestern. We have people from Kentucky and Case Western and the DEA. We have chief scientists at the NMS labs. We have people in the Artificial Intelligence Institute. And we have people from Vital Statistics and also University of New Mexico. We also take advantage of a wonderful network of early warning systems. This is our Sentinel network. These are the different sites around the country. And they were part of a community epi work group from the past. And we have kept them in our network. We've added a few more, but we think we have really good coverage from around the United States. And in our next slide, we can see the site directors at those sites from Atlanta, Chicago, Denver. We have Detroit, Duluth. We have the whole state of Florida, the whole state of Kentucky, Los Angeles, New York City, Philadelphia, Phoenix, San Diego, San Francisco, Seattle, St. Louis, the whole state of Texas, and Washington, D.C. We do want you to take just a second here. Get your phones, scan the QR code, and sign up for our free weekly briefing. We have a briefing that comes out every Friday morning at 9 o'clock, and it will really give you some great outlooks into what's happening. We have some of our own data that we present. We have all of our archived weekly briefings here. We have some media metrics. Right now we have over 3,500 people who are subscribed. We have, we keep track of all of our metrics here, how many people really look at this information, but we really do want to make sure we get this information out into the hands of the people who need it, including all of you, people who would be interested, as well as departments of health. So please click on the code and sign up for the newsletter. And we do want to thank our partners from the National Institute on Drug Abuse to the other partners that I mentioned here. These are really important collaborators, people that we really rely on every single day to help us to understand what's going on in the community. So what we're going to do now is we're going to hear from the different initiatives that we have going on. And we'll start off with Joey Palamar talking about increases in fentanyl seizures. So thank you very much.
Thanks for having me. So as Dr. Cottler mentioned, I'm going to discuss some fentanyl seizure trends in the United States covering the past 2 years. These are pretty recent data. As you can see, it goes through 2022. So quickly, what is HIDA? HIDA is the High Intensity Drug Trafficking Area Program. It was created by Congress in 1988 and funded by the ONDCP. It's directed by Tom Carr, and he's also an NDEWS affiliate. So HIDA was created to assist federal, state, local, and tribal law enforcement agencies in various areas throughout the United States, anything deemed a critical drug trafficking region. There are 33 separate HIDAs throughout the 50 states and DC, which it covers the entire United States for the most part. And we actually obtain data on the seizures made throughout the US. HIDA was created to disrupt and dismantle drug trafficking organizations and also just basically to remove drugs from the streets. We use HIDA data or any seizure data as an indicator of drug availability. Really quickly, I just want to mention this. There are a few brief comparisons comparing HIDA and the DEA. I mention this because a lot of people are only familiar with the DEA seizure data. So the DEA NIFLS data, there's typically a publication lag of about a year. With regard to HIDA, now we're trying to get out the data quickly, sometimes only a few months after it's available. With regard to availability of data to the public, it's very hard to get your hands on actual data as a researcher from the DEA. But from HIDA, you could actually apply for case level data pretty easily right now on the website. And if anyone ever has any questions about that, drop me an email. With regard to geographic data, for the most part, the DEA, to my knowledge, is national only. But with the HIDA, as you'll see today, we could very easily look at not only national, but state and county level data. With regard to purity, I mention this because I'm focusing on fentanyl. The DEA does have a lot of advanced drug purity data on many cases, but not all. Unfortunately, we don't have the drug purity data with HIDA. And more specifically with fentanyl, we don't have the data on the specific analogs. It's just coded as fentanyl, yes or no. But anyway, moving forward. So overall, I want to basically just break down the differences between the 2021 seizures in the United States and 2022 to see how things increased within that year. And as you can see on the figure, the number of pill seizures increased by about 85%. So it nearly doubles. The number of powder seizures, which is the middle bar on the side, that increased by about 65%. And the number of seizures overall, that's combined pills, powder together, increased by 70%. With regard to changes in the weight seized, I think it's important to differentiate. So what I just mentioned, that was the number of seizures. So this is how much weight was seized. So the total weight of powder seized increased by 35%. But if you collapse the data and look at weight and pills combined, then the increase in total weight went up by about 62%. So pills are a very big part of the seizures right now, but definitely not all of it. One thing I think that's important to mention before I move on is I wanted to show you the difference between heroin and fentanyl seizure trends over time. If you look at even not that far back, 2019, 2020, heroin seizures still made up the majority of seizures compared to the other opioids. But once we hit 2021, fentanyl made up the vast majority of seizures of opioids, and you can see that starts trumping fentanyl seizures. And by 2022, fentanyl seizures completely dwarf the heroin seizures. So heroin is being completely wiped out by fentanyl right now. Fentanyl is the big opioid going around right now. With regard to changes by region, this is more than 2 years, but I just want to show you how this shifts. These are some preliminary analyses I've been doing. If you look on the left, those are the changes in powder seizures by region, and the red line should stick out, and that is the South. So the powder seizures primarily are going up in the South. Of course, they're going up throughout the entire United States, but primarily the South. If you look to the right, pill seizures, it's really the West that is driving everything. So pill seizures are definitely going up, but primarily in the West. And you will see a lot more examples of this in the next few minutes. The reason the pill seizures are of importance, I think, mainly because a lot of people can confuse these with common prescribed drugs. These are examples. These are taken from a DEA site showing you what counterfeit versus actual pills look like. And on the left, they compare oxycodone, alprazolam, like Xanax is in the middle, and Adderall is on the right. And it's very hard to tell these apart. So a big concern is that someone who does not use opioids is going to take one of these thinking it's one of these pills and then be poisoned or overdose on a fentanyl. And something that's important to show you, I want to show you a comparison of the 2021 and 2022 DEA alerts that are all over the internet. You can see back just 2 years ago, they say that only 4 out of every 10 pills were a lethal dose, but that went up to 6 out of every 10 pills just last year, which suggests that pills now more commonly have 2 or more milligrams of fentanyl in them, which makes them much more potent. So anyway, getting to state level analysis, I'm going to go back and forth a little bit between pill and powder seizures, but with regard to the number of pill seizures, whether it's a few pills or thousands of pills seized, you could see that all the dark blue is on the left here in the West. So the highest number of pill seizures was actually in Arizona with almost 1,400. And that was followed by New Mexico and Colorado. With regard to the shift between 2021 and 2022, again, you could see that almost everything is out in the West as per the dark coloring on the side. But the largest increase was actually in Colorado and followed by Arizona, but still on the West. Now, the number of powder seizures, you can see it's a much different phenomenon. With the pills, almost everything was in the West. Here, it's much more spread out. The highest number of powder seizures was actually in Florida, approaching 1,700 separate seizures of powder. And the next was actually Ohio. And comparing 2021 to 2022 number of powder seizures, the largest increase was actually in California. It almost went up about 600 additional seizures within a year compared to the previous year. So a lot more seizures in California. Florida had a big increase by over 500, and also Texas and Colorado. We're seeing some very big increases in some of these states. Weight of powder seizures. You can see California is clearly lit up as the only state which had a very large amount seized. In fact, when you look at the aggregate total for 2022 in California, when you convert the kilograms to pounds, that's almost 10,000 pounds of powder fentanyl seized within that year. That's a lot of fentanyl. And that was followed by Florida, which had a much smaller amount, but is still really a very big amount, almost, over 1,000 kilograms. Increases from 2021 to 22 regarding weight. The biggest increase was in Florida by about 1,000 kilograms, and that was followed by Tennessee and Colorado. And I think it's interesting and important to focus on also the number of individual pills seized, because a lot of public service announcements are saying, one pill could kill, or saying how dangerous a single pill could be. So when you look at them in terms of individual pills, the highest number of individual pills seized in 2022 is in Arizona, almost 25 million individual pills. Last time I looked at the census for Arizona, I think it was roughly 7 million people. So to put this in perspective, within the state of Arizona, that's 3 pills per person within that state. That's a lot of pills. And in California, close to 11 million separate pills seized. And my last or second last slide, the percentage of pill seizures out of all seizures, the highest percentage pills is actually in Idaho, followed by Arizona. So again, you could see whenever we talk about pills, most things cluster around the West. I don't want to take up too much time, but just to briefly summarize, fentanyl seizures are continuing to increase throughout the United States, some areas more than others. Pill seizure increases are very much driven by the West. Seizures, as I said, could help indicate drug availability, but there's a limitation. We don't know the targeted destination of the fentanyl product. So even though we're focusing on state level, we don't know where the destination was actually supposed to be. That's a reason I actually don't compute rates for the state level, by the way. So we need to continue monitoring drug seizures to inform timely surveillance, and that's that.
Thank you. So now I'd like to talk about one of NDEWS' novel surveillance methods that Dr. Cottler mentioned, the Rapid Street Reporting Project, with the purpose of identifying emerging drugs. My name is Anna Wang, and my co-coordinator, Nay Wang, are both in charge of the Rapid Street Reporting Project, also known as RSR. Here is listed our funding source, and we have no other conflict of interest to disclose. So RSR is a national venue intercept study with the objective to assess the use of over 100 drugs, many of which are novel psychoactive substances. On the right here of our 17 Sentinel sites, we travel to each one at least once, and 13 of them we travel to twice. We also have 5 additional hotspots that we plan, totaling to over 35 data collection weekends by the end of 2024. Our data collection weekends occur on a monthly basis, January through November, and over a weekend period, Friday, Saturday, and Sunday. For year 1, we visited 13 cities between November of 2021 and all the way through 2022. 2 of which were hotspots. For our data collection weekends, we assemble a team of graduate students or staff with equivalent research experience to conduct on-the-ground data collection. We have the opportunity to send 2 of our UF lead interviewers to be partnered with 2 or 3 other interviewers from the local site. During the data collection weekend, our interviewers use our survey to collect data. Our survey is a modified version of NYU co-investigator Dr. Joseph Palamar's validated street survey, which assessed 4,500 nightclub attendees on the use of over 100 drugs and any experienced acute adverse effects. Our data is collected through the use of our anonymous rapid survey, which takes an average of 5 to 10 minutes, and we also provide a $2 bill as an incentive for completing the survey. In our survey, we ask about past 12 months of use, last month of use, and adverse effects experienced for more than 90 different substances. We assess the use of common substances such as alcohol, cocaine, marijuana, as well as substances such as synthetic caffeine, dissociative, euphoric stimulants, and many more. Additionally, we also asked about new drugs, and we have recently added a new question on how different drugs are used together. Our survey also has an optional hair component for respondents to provide a hair sample, which is important for investigating the use of NPSs to determine if what individuals are self-reporting on the survey is matching with what has been identified with hair testing, especially since many people are unknowingly exposed to adulterated drugs. Before our data collection, all of our interviewers are trained on study protocol, data collection, and best practices, and our interviewers are required to have HIPAA and IRB training. As an venue intercept study, our interviewers are on the field at local public venues with high foot traffic to recruit participants. To reduce selection bias, we train our interviewers to recruit everyone, and we utilize different methods to make sure to ensure that. One of these methods is a box method, in which you draw an invisible square around a specific area and approach everyone within that area. And similarly, the line method, you would draw an invisible line possibly across a sidewalk and approach everyone that crosses that line. We also utilize up-to-date census reference sheets to help maintain a diverse recruitment of participants that reflect similar demographics of that city. In order to be eligible for our study, participants must live in the United States and be 18 years or older. Our venue list consists of recommendations from experts in the field, including our Sentinel site directors, as well as other NDEWS investigators. When selecting our venues, we prioritize the presence of our target population and the safety of our interviewers. So our venues often include a variety of locations such as plazas, malls, skate parks, transportation stops, nightlife venues, as well as many more. And if you look at the pie chart here on the right, you'll see that the venue breakdown of our enrollment data for year 1. You can also see that parks, sidewalks, and town squares / plazas were shown as with the highest level of recruitment for our venues. And next, I'll pass on the rest of the RSR presentation to my co-coordinator, Wang, who'll be going over some of the RSR findings.
So on this slide, this table shows the breakdown of numbers of people enrolled at each site of collected in year 1. So in total, 3,130 participants were enrolled from 13 data collection sites with 411 hair samples collected. The demographic breakdown was a mean age of 37.2 years, ranging from 18 to 90 years old. And the highest level of education attained was 14.8 years, ranging from 0 to 40. The gender breakdown was identifying as male, 62.5%, 34.8% identifying as female, 0.7% trans, 1.7% non-binary, and 0.3% as other. And for a racial breakdown, the participant identified 56% as white, 24.4% as Black, 9.3% as Asian, 2.0% as American Indian Alaska Native, 0.3% Native Hawaiian Pacific Islander, and 8% as other, including multi-races. So next slide. On this table, it shows the rate of drug use that were reported for past 12-month use based on self-reports across our site recruitments. This is grouped by regions, as you can see, West, South, Northeast, and Midwest. So according to our year 1 data, other than alcohol, marijuana for recreational use, psilocybin, cocaine were the most commonly reported for past 12-month use for overall of all the participants enrolled in year one, as well as for each region. So overall, 51.8% of the participants reported marijuana use for recreational purposes, 13.2% reported psilocybin use, and 11.7% reported using powder cocaine in the past 12 months. We also found an interesting pattern for the top three substances, marijuana, psilocybin, cocaine, and that the highest percentage of reports were found in the West, followed by the Northeast, and then South and Midwest for psilocybin, cocaine, and Midwest and South for marijuana for recreational use. And this is not the case for the other drugs we listed below cocaine. Next slide. So we disseminate our RSR findings on the weekly NDEWS briefing. The report is typically sent out within 1 month of each data collection site visit. We report on past 12-month use reported in the area, as well as the past month use, and along with demographics of participants recruited at each of these sites. All of the previous reports are available on the NDEWS website under the Rapid Reporting page for each of the site collections that we have done. And in addition to reporting our findings of these past month and past 12-month use for each site, whenever we identify a new drug or emerging drug trend, we cross-check this data with our NDEWS team, and we'll send out a special report. For example, after our Seattle site collection, we had several reports of a substance called M30. And so we brought this to the team, and our web monitoring team, which is another component of NDEWS, also saw increase in mentions in the subreddit data. So then we created a special report on M30 as seen on the right of this slide. Along with findings of M30 in year one referred to in our Seattle RSR site visit, this was called Blues in several of our participants. And so some other interesting findings included xylazine, which is a sedative drug typically used for veterinary anesthesia. And adverse effects that were reported for xylazine from our participants include maniac episode and heart rate dropping. The web monitoring team also back in January 2022 reported increase in Delta 8 in the subreddit data, and this was also seen in our Atlanta data collection visit in January 2022 regarding drug trends in the community, which was also an interesting finding. And for all three of these substances, since we have collected past 12-month and past month reporting specifically to these three, and so we're hoping that once we have some more data, we can do a little bit more report on what we found. RSR is an important piece of surveillance as it is the only component in NDEWS that is a direct measure of substance use that's reported from people. So our findings can provide a signal for those working in the field about possible emerging trends as well as current recency of use. And another impact is the training opportunity. So as Anna mentioned, RSR sends out graduate students as interviewers. And so this primary data collection opportunity has been extremely a valuable learning experience for future investigators. So as we mentioned, we are continuing to do data collection site visits. We are in year 2 right now, and we will be continuing to year 3. And so if you're interested in keeping up with all of our reports, you can sign up for the NDEWS weekly briefing by scanning the QR code to the right. Thank you.
Howdy, y'all. I am with the NDEWS web monitoring team. And so my name is Daniel Van Zant. I am a PhD student down at Florida Atlantic University. So I'm one of the several sort of remote arms of the NDEWS team. I work with my professor, Dr. Ilan Barinholtz, to monitor different drug subreddits and some other online sources to see how people are talking about these drugs, how much people are talking about these drugs, and hopefully provide an early alert to some of these things or be part of providing an early alert. So here is our methods. Essentially what we do is we mostly use Reddit for the weekly briefing. We scrape over 80 different drug subreddits. We feed all of that data into a machine learning classifier. That classifier helps us understand what drugs have gotten popular more recently that maybe other people haven't heard of in terms of online discussion. And then we're able to quantify the mention counts from that scraped Reddit data to provide a picture of the popularity of this drug on these 80 different drug-related subreddits over time. Our sources can also be our collaborators, and then occasionally we'll see something on Reddit that we just have never heard of. It seems to be fairly popular on these drug subreddits, and we'll run a report on that as well. The first drug I would like to talk about is 2CB. I have 3 drugs I'd like to talk about: 2CB, fluorhexetamine, and xylazine. The first is 2CB. This is a drug that has started as a party drug in several Latin American countries. From what I understand, primarily Colombia. It's called 2CB or Tucci or pink cocaine. It usually has ketamine and many other substances like MDMA, cocaine, caffeine. I actually saw a video where they were interviewing somebody while they were making it, and he pretty much said, yeah, we just kind of throw in whatever. So they don't really worry, the people who are making this don't really worry about how dangerous any of the substances they're throwing in are. They just throw it all in, put a pink dye in it, package it up, and sell it as a party drug. It is currently spreading in the US. I know I've heard several reports from my team that I'm collaborating with on this, that it's showing up more and more stateside, unfortunately. One note is that this can get confused with a common psychedelic dissociative called 2CB with the number 2. It seems like this drug was originally started as and marketed as kind of the new 2CB, although it's come into its own and it's a very different thing. But it's worth noting, if you're looking to do some research on this, that those are 2 very different drugs with very different effects and makeups. The next trend highlight is fluorhexetamine, or FXE. It's a dissociative in the aryl cyclohexylamine family. In November, it was the most highly mentioned term in our subreddits besides fentanyl. So this got very, very popular. The effects are reported to be very similar to ketamine, with some reports of mania in the Reddit discussion. And as you can see, there was just a giant spike there, sort of almost out of nowhere. The last drug I'd like to talk about is xylazine. I'm sure many of y'all have heard of this one. It's a veterinary anesthesia that fentanyl is being cut with. It's extremely harmful. It causes necrotic skin ulcers and other medical issues. And if you've heard on the news of xylazine or fentanyl zombies or any of these terms, this is usually what that's talking about. And so this isn't a drug that people are seeking out necessarily, as far as I'm aware. It's more one that's being put into the fentanyl supply without telling the people who use it, because it's cheaper and has similar effects. And then the last thing I wanted to show was the NDEWS report for xylazine compared to how this was covered on Google Trends. So this is a graph of the mentions of xylazine on Reddit versus the mentions of xylazine on Google Trends. So how much people are Googling, hey, what is xylazine? What is this? And as you can see, we were able to alert almost a year before xylazine got really well searched in Google Trends, and about 6 months before there was any sort of spike on Google Trends. And you can see that spike before the red dot. That's what we alerted to. And so I'm sure every one of my collaborators at NDEWS could have a similar story to this about a drug that got really big and was really harmful. And because of their work in wastewater, rapid street reporting, or whatever it is, they were able to alert people early too. So I like to include this slide in any presentations I do, just as another plug for a weekly briefing. The NDEWS team has absolutely proven ourselves as being extremely useful in alerting to these harmful substances early.
Thanks, Daniel. Hi, everyone. As noted previously, I am MeLisa Kramer. I am actually a program official and the project scientist for the NDEWS project at NIDA. As Linda mentioned, this is a cooperative agreement grant, which means that there is scientific input from NIDA on this. And so I am lucky enough to join the team every week and be able to have influence over what's happening. And so I just wanted to give a little bit of a perspective of where NIDA is coming from and why we have NDEWS as a project. It's been a project now as a grant. This is the second iteration of it as a grant, but it had foundations in the community epidemiology working groups, which you may have heard of. So as I said, I work primarily, I sit within the epidemiology research branch at NIDA, which our mission of ERB is to promote a national and international extramural research program that examines the impact of individual, familial, behavioral, developmental, and socio-cultural environmental risk and protective factors related to substance use, misuse, and addiction. The findings from the projects that we fund within ERB will be used to inform prevention and services research to reduce the burden of substance use, misuse, and addiction on the nation's public health. And NDEWS is just one example of our really important projects that informs not only our branch, but is critical to understanding, excuse me, critical to understanding what's happening in the community. And the data from NDEWS has been used by multiple agencies. We get requests frequently from the Office of Science, Communication, and Policy at NIDA of what has NDEWS heard about certain drugs, what's happening within communities, and it's just a really critical project that brings together multiple data sources to inform not only NIDA, but those who are working in the fields of both drug use and misuse. And one of the most vital parts of NDEWS is the bidirectional relationship between NDEWS and its partners and the community. So community engagement is really the foundation of what the first iteration of NDEWS was, as I mentioned, the community epidemiology working groups, and continues in this current iteration through the network of Sentinel sites. We value all of our community partners like you to not only help disseminate our findings, but we also ask for you to provide us information. So you've heard every speaker today talk about signing up for the weekly briefing. And one of those reasons is we ask for feedback on that. And so there's an option to respond to any of the stories or things that are presented within the weekly briefing that will allow you to tell us if you've heard the same thing, if you know something that's happening, so that we can triangulate the information. We want to know what is going on in your own community and what you can tell us, so that we can either tell others or bring together information from the various data sources that we have access to potentially find new signals and warnings to inform both local policy, but also response to the crisis that's happening within the drug marketplace over the United States. And we know that there's an opioid crisis, but we also know that there's always a new drug on the horizon, which is why, as Daniel pointed out, the xylazine trends have been really interesting, but there's going to be another xylazine, there's going to be another fentanyl. And so one of the important pieces of NDEWS is to be able to really understand where that happens and how we can stop it from spreading like it has in the past. And so with that, I think we will move on to questions and answers. But before that, I do just want to acknowledge Linda, thank the partners at the beginning. I would be remiss to not thank our partners. We have a wonderful team of partners that have been established over the course, both research institutions, universities, and public health agencies such as CDC and other regulatory agencies like FDA, DE, all of that. And then one last plug is for you to sign up for our weekly briefing or subscribe to our Twitter account, and you can see what's happening. So with that, I would like to close out the formal portion of the webinar and answer the question and open the question and answer period.
So I did get a couple of people texting me or emailing me asking about the slides. So probably early next week, the presentation will be sent out to all of the attendees. And then probably about 6 weeks later, we will be posting it on our YouTube channel for the broader audience. And we do like to only have the webinars open to members and sponsors. There needs to be a benefit to membership and sponsorship. So I did get that question. Also, I actually have a question. I'm sure Carrie may have some questions, and feel free to write questions in the chat or the Q&A box. But I'm just curious, you interview people in the clubs, and I'm just curious how willing they are to answer the questions.
I'm guessing this is referring to the rapid street reporting project.
Yes.
So we're not directly inside the clubs. We're kind of around that venue space, so within the block of it. So we're capturing the people that are going to the clubs. And in addition, because our survey is anonymous, we don't collect any personal information. We haven't seen any, people are a little bit more willing to answer the question. So yeah, we haven't seen any of the hesitancy.
We also, as a reminder, we utilize the $2 bills as an incentive, and we found that it is quite like a novel item, so that people have been quite receptive about wanting to do this survey, even just because of the $2 bill incentive we provide.
Okay, and so one question, is there a single subreddit that is monitored for activity regarding the subject matter, or is it a compilation of several subreddit communities?
Yes, hello. There's over 80 subreddits. I think we're actually might be over 90 now, since we have people send an extra subreddit to us sometimes when we add it. And this is a compilation of all of them. Usually each drug has 2 or 3 subreddits that it's discussed the most in, but that differs drug to drug. There's a couple subreddits that are commonly in one of the top subreddits for all of the drugs, and those are r/drugs and r/research chemicals. So if you're interested in seeing one of these subreddits for yourself and reading some of the comments on a drug, those are the subreddits I would refer to.
Okay, so another thing I did want to mention for all of the attendees is, now that we have found source of good additional information, we included their website on our helpful links on our website. So if you're interested in sort of connecting, or you didn't get the scan, you can go there and get the information that you need.
This has been very informative. So because this is relatively new, do you plan to expand your Sentinel sites down the road to, further sites? I don't expect you in South Dakota anytime soon, probably, but it's great that you're actually accessing those locations.
So I guess I can answer that question. We're in the 4th year of a 5-year grant, and we really set out to have set these 17 Sentinel sites. But over these years, we have really learned that there may be a need for us to do more quick and have more sites, that we would be able to utilize more geographical areas and have more feedback and input from other places. So we did actually contemplate the Dakotas, and there are interested people there. There are things going on there. So every place is a place of interest to us. And if ever there was anything that was going on there, an outbreak, for example, we would want to do a hotspot visit there. But yes, we are always entertaining more places to go. Thanks for the question.
So one question I also had, and you don't have to necessarily answer it right now, is if there is something that our members could be providing to you or helpful in any way, be it like the survey, or we certainly have a lot of knowledge base if you were looking to pick people's brain about something in particular, we could set up a separate Zoom invite with a subset or a smaller or larger subset. I would just throw that out, and certainly come to our conference. I'm sure you'll hear a lot, boots on the ground, if you will. Lisa McEnany said, thank you for all your hard work. NADI incorporates all of your information into our website and glossary. It is truly beneficial for our members.
That's terrific. Regarding the survey or being in touch with your members, we would love to have another conversation with you all on one of our Thursday calls, because we would like the opportunity to post a question, 2 or 3, to your members to find out what they might know about certain things, or a bi-directional conversation where they want to let us know about something that's happening. This is extraordinarily important to us. And in addition, the briefing has a place where for every single article that we discuss, or every piece of information, there's a place for people to respond and give us information. And so we would really love that opportunity again, Carrie and Kathy.
All right, we'll be in touch. Any other questions? I don't see anything in the chat or the Q&A. So I think...
No, but this has been excellent, and really thank you for sharing your insight and expertise on this program, and the importance of it certainly is not lost on this audience, because this is a lot of what we have been doing over the years, and so very important, very informative stuff. I liked hearing about pink cocaine. I mean, there's some new things that we never even have heard about. So really, really great information on that side as well. So any more questions in the chat, Kathy?
I do not see anything at this moment.
Okay, if not, any more comments from the presenters? Otherwise, I will close it out. Once again, thank you to our speakers. Thank you, Kathy. It's been excellent education for our NASCA membership. On behalf of the National Association of Controlled Substance Authorities, I would like to thank everyone for joining us today on this webinar. And again, thank you to our sponsors for making the webinar possible. We wish you a wonderful rest of your week and have a happy and safe Memorial Day weekend.
Thank you.
Thank you.